Picture this. You're 74, you still garden every morning, and halfway to the mailbox, your calves feel heavy, tight, and strangely tired. Then someone tells you the missing piece may be one vitamin, not vitamin D. Here's what I'll show you today. You know this feeling. You stand up, you start walking, you expect your legs to warm up, and instead, they feel slow, heavy, a little numb maybe. Not dramatic, just not right. You walk through the grocery store, and your calves start talking back. You climb a few stairs, and your legs feel tired sooner than they used to. At night, your feet may feel cold, prickly, or restless. And you start wondering, is this just age? That's a fair question. Most people over 60 ask it. Quietly. Picture someone in this situation, an illustrative scenario, a composite. A 71-year-old retired school teacher, still proud of her backyard roses, still takes morning walks with her neighbor, still does her own shopping. She isn't looking for a miracle. She just wants her legs to feel dependable again. That's the kind of problem we're talking about today. I'm Jason Ford. On this channel, I review published research on senior health and translate it into plain English. The kind of plain English a 15-minute appointment often doesn't have time to give you. Before we go further, drop 2 things in the comments: your age and the city or state you're watching from. I read every comment on this channel. It changes what I make next. Take 5 seconds, drop it below. I'll wait. Now here's the twist. The vitamin we're talking about is not a magic artery cleaner. It does not scrape plaque out of blood vessels. It does not replace your doctor's care. But if you're low in it, correcting that may help support healthier oxygen delivery, nerve function, and the way your legs feel. That vitamin is B12, and for a lot of older adults, B12 is easier to miss than people think. Let's make this simple. Think of vitamin B12 like a quiet support worker in the background. You don't notice it when it's doing its job. But when it's low, a lot of small systems start slipping at once. Your red blood cells, your nerves, your energy, your balance, even the way signals travel down into your feet. The NIH Office of Dietary Supplements says, vitamin B12 is needed for healthy red blood cell formation, for DNA synthesis, and for the normal function and myelination of the nervous system. Myelination just means the protective coating around nerves. Think of it like the insulation around a wire. Good insulation, clear signal. Damaged insulation, messy signal. So what does that mean for your legs? First, red blood cells carry oxygen. If B12 deficiency leads to anemia, those cells can become too large and not work as well. Mayo Clinic explained in 2025 that vitamin deficiency anemia means you have too few healthy red blood cells, and those cells are less able to carry oxygen through the body. Less oxygen, less steady muscle function. That can feel like weakness, shortness of breath, tiredness, or legs that give out too soon. Second, nerves matter. A lot. Mayo Clinic's 2025 guidance lists numbness, tingling, muscle weakness, and unsteady movement among symptoms of vitamin B12 deficiency. A 2014 Mayo Clinic Q&A on aging and B12 said the early signs can include a persistent tingling or prickly feeling in the feet or hands, weakness, numbness, and imbalance. So, if your feet feel odd, cold, buzzy, or unreliable, that may not be pure circulation. It may be nerve trouble, and B12 is part of that conversation. But here's the problem. People use the word circulation for almost everything below the knee. Cold feet? Circulation. Tingling? Circulation. Cramping? Circulation. Heavy legs? Circulation. Sometimes that's true. Sometimes it isn't. The American Heart Association says peripheral artery disease, or PAD, happens when arteries that carry blood to the legs narrow from plaque buildup. Their PAD overview says common symptoms include cramping, fatigue, aching, pain, or discomfort in the leg or hip muscles while walking or climbing stairs, and that the pain often eases after a few minutes of rest. That pattern matters. If discomfort shows up with walking, then fades with rest. That's a clue. If you also notice sores, color change, or trouble walking, that's a different level of concern. Cleveland Clinic says PAD symptoms can include pain, cramping, numbness, or fatigue in the calves, thighs, or butt during activity, plus burning or aching pain at rest in more severe cases. They also warn that sudden color change, very pale skin, cool skin, or pins and needles with severe pain can signal a more urgent problem. So where does B12 fit? Right here. B12 deficiency can overlap with leg symptoms. It can make weak legs feel weaker. It can make numb feet feel more numb. It can make walking feel less steady. And because absorption problems get more common with age, older adults are more likely to miss it. The NIH Office of Dietary Supplements reports that between 3% and 43% of community-dwelling older adults may have vitamin B12 deficiency, depending on how it's defined. Stop on that for a second. 3% to 43%. That's a huge range. And the point is not the exact number. The point is that low B12 in older adults is common enough to take seriously. The same NIH source says atrophic gastritis affects about 8% to 9% of adults age 65 and older, and that this can reduce stomach acid and intrinsic factor, both of which help you absorb B12. Intrinsic factor is the helper protein your gut needs to pull B12 in. No helper, poor absorption. And the 2014 Mayo Clinic piece adds two things a lot of people miss. Acid-reducing medicines, like proton pump inhibitors, and metformin, a common diabetes drug, may interfere with B12 absorption over time, so now the picture gets clearer. Your legs may feel off for more than one reason. One lane is blood flow, another lane is nerve health, another is oxygen delivery. B12 sits right in the middle of that crossroads, quietly. If this is useful so far, subscribe. I do one of these every week, and I try very hard to make them worth your time. Now we're getting to the part that matters most. What to do with this information. Step 1. Ask whether you should be tested, not whether you should guess. This is the step almost nobody talks about first. If you're over 60 and you have tingling feet, balance changes, weakness, unusual fatigue, shortness of breath, pale skin, or legs that feel older than the rest of you, ask your doctor whether checking your B12 level makes sense for your situation. If you've been on metformin, acid blockers, or you've had stomach or intestinal surgery, ask about that too. Why does this step matter? Because symptoms can overlap. Low B12 can look like aging. It can look like neuropathy. It can look like poor conditioning. It can even sit there without obvious anemia at first. The 2014 Mayo Clinic article says you can be low in B12 even if you're not yet clearly anemic. That's why guessing from symptoms alone can mislead you. What to ask your doctor? Would a B12 test help here? And do I have risk factors that make deficiency more likely? Step 2. Don't confuse food intake with absorption. This next one is the one many families miss. You may be eating enough B12 and still not absorbing it well. B12 is found naturally in meat, fish, shellfish, eggs, and milk. Fortified cereals can contain it too. But the Mayo Clinic and NIH both make the same basic point. Aging, digestive disease, pernicious anemia, certain surgeries, and some medications can reduce absorption. So if someone says, I eat eggs, I eat chicken, I can't be low, that's not a safe assumption. Not at this age. Why does this step matter? Because if the problem is absorption, food alone may not fully solve it. The 2014 Mayo Clinic guidance said B12 is one of the few vitamins their experts routinely recommend older adults think about, precisely because deficiency becomes more common with age. What to ask your doctor? If my level is low, do I need food changes, an oral supplement, or something stronger because of absorption? And let me say this clearly. Do not self-prescribe high-dose supplements as a substitute for medical guidance if you have major symptoms. Talk to your own doctor. Step 3. Rule out real artery disease if your symptoms fit that pattern. This is the surprise step because it has nothing to do with a supplement shelf. If your calf pain starts when you walk, stops when you rest, and keeps repeating in that pattern, ask your doctor whether peripheral artery disease should be considered. The 2024 ACC/AHA Multi-Society Guideline says a resting ankle brachial index, called an ABI, is recommended to help establish the diagnosis when exam findings suggest PAD. An ABI is simple. It compares blood pressure at your ankle with blood pressure in your arm. That's it. No mystery. Why does this step matter? Because a vitamin may help if you're deficient, but it will not replace evaluation for a narrowed artery. And this is where many videos blur two very different problems into one. If you've got tingling and poor balance, B12 deserves a look. If you've got walking pain that eases with rest, PAD deserves a look. Some people have both. That's why the right question matters. What to ask your doctor? Do my symptoms sound more like neuropathy, anemia, PAD, or some mix of the three? And should I have an ABI? Now this next one is the one everyone misses. Step 4. Walk in a structured way, not a random way. The 2024 ACC/AHA guideline says, supervised exercise therapy, or a structured community-based exercise program, is recommended for chronic symptomatic PAD to improve walking performance, function, and quality of life. That matters because many people think, my legs hurt, so I should baby them. Sometimes rest is needed in the moment. But over time, the right walking plan may help far more than drifting in and out of activity. Notice the wording here. Structured. Not heroic. Not punishing. Structured. Why does this step matter? Because movement trains the body differently than wishful thinking does. If reduced blood flow is part of the problem, the right exercise plan may help your body use what flow it has more efficiently. What to ask your doctor? Would a structured walking program be safe for me? And do my symptoms fit something like PAD or deconditioning? If you've made it this far, tell me in the comments which symptom sounds most familiar. Heavy calves, cold feet, tingling, cramping, or short walking distance. I read those patterns very closely. Step 5. Treat the whole circulation picture, not one vitamin in isolation. This is the big payoff near the end. Even the best vitamin conversation can go sideways if it becomes too narrow. The 2024 ACC/AHA guideline recommends high-intensity statin therapy for PAD, blood pressure treatment to reduce cardiovascular risk, and strong attention to diabetes and tobacco exposure. Cleveland Clinic also lists smoking, diabetes, high blood pressure, high cholesterol, and chronic kidney disease as major PAD risk factors. So if you're thinking, tell me the one pill for my legs, the honest answer is, there usually isn't one. There is a pattern. If you're low in B12, correcting that may help. If you have PAD, you may need a walking program, risk factor treatment, and sometimes medication or procedures. If you're anemic, that deserves direct care. If you're on a medicine that lowers B12 over time, your doctor may want to monitor that. One lane, not the whole highway. And here's the shareability moment. A lot of people say, my circulation is bad. But what they really mean is one of three things: poor blood flow, poor nerve signaling, or poor oxygen delivery. Those are not the same thing. And your next step changes depending on which one is driving the problem. If you have a parent or a spouse or a friend this applies to, this is worth 60 seconds of their time. Send it to them. Now, I want to answer the question I know is in your head. Can vitamin B12 restore leg circulation? Here's the honest answer. Not by itself, not in every case, and not if the main problem is plaque in the arteries. But if you're deficient, bringing B12 back to a healthy range may help improve the system's B12 supports: red blood cell formation, nerve function, and symptoms tied to deficiency. That's a meaningful difference. It just isn't magic, and it isn't universal. Picture another illustrative scenario, a composite. A 76-year-old retired mail carrier still fishes on weekends, starts noticing that his feet burn at night, and he feels unsteady in the dark. He assumes it's circulation. His doctor checks deeper. The issue turns out to include low B12. That's not every story, but it's a common enough story that it deserves a place on the list. Let me name the sources one more time, because you deserve to know where this comes from. The NIH Office of Dietary Supplements explains B12's role in red blood cells, nerves, and deficiency risk in older adults. Mayo Clinic's 2014 Q&A says B12 deficiency becomes more common with increasing age and lists tingling, weakness, numbness, imbalance, and memory changes among possible signs. Mayo Clinic's 2025 page on vitamin deficiency anemia explains how low B12 can reduce the body's supply of healthy red blood cells, lowering oxygen-carrying ability. The American Heart Association outlines common PAD symptoms, especially pain or cramping with walking that eases with rest. And the 2024 ACC/AHA Multi-Society Guideline lays out the modern approach to PAD diagnosis and treatment, including ABI testing, structured exercise, and risk factor care. Now for the red flags. There are situations where you should call your doctor today. Not next week. Today. If you have leg or foot pain at rest that is new, strong, or getting worse. If you have sores or ulcers on the feet or legs that are not healing. If one foot suddenly turns pale, purple, dark, or unusually cool. If you have sudden numbness, severe weakness, or sudden trouble walking. If calf pain with walking keeps repeating, and your distance keeps shrinking. Those are outside the scope of a video like this. They need direct evaluation. Let me run through the core points quickly. 1. The overlooked vitamin here is B12, not because it magically fixes arteries, but because deficiency may affect nerve function, red blood cells, and how your legs feel. 2. Low B12 becomes more common with age, partly because absorption can drop. 3. Leg symptoms are not all the same. Tingling may point toward nerves. Walking pain relieved by rest may point toward PAD. Fatigue and shortness of breath may point toward anemia. 4. The smart move is not guessing. The smart move is asking the right question and getting the right test. Here's the whole message in one sentence. If your legs feel older than the rest of you, don't blame age alone. Ask whether B12, blood flow, nerve health, or anemia is part of the real story. And there's one thing I still haven't told you. The reason some people walk better within weeks, while others don't improve until the underlying cause is separated out piece by piece. And that's exactly what next week's video is about. Because I'm going to show you the difference between leg weakness, nerve pain, and true circulation pain in plain English. If this helped you see something new, subscribe. Next week, I'm walking through how to tell the difference between neuropathy, poor circulation, and simple muscle loss after 60. And in the comments, I'd love to hear, have you ever been told your leg symptoms were just aging and later found out there was more to it? Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.